The health department is actually aiming to inoculate at least half of this cohort by January next year. The move comes as a slow uptake from older group threatens the goal of vaccinating about 70% of the population by the end of this year. More insight for you. Bringing the health department's acting director general, Dr. Nicholas Crisp, who joins us now via Skype. And Doc, always great getting your thoughts on these issues. Thanks for making time. I suppose, part of the anticipation from your teams is that things will get busier in the afternoon, given the fact that during the morning and the, mid-afternoon, some of the kids are still in school.
Good morning, Ayanda. Morning to the viewers. So indeed, the vaccinations open from, the system is open from 8 o'clock for vaccinating children between the ages of 12 and 17. And there's been a lot of pressure on us for some time to open for this age group. It's not an either or with adults and children. We still want to vaccinate 70% of the adult population, and children are on top of that. We know that it's going to be very difficult to get to 70% of the adult population, and it gets more and more difficult as we get more of them vaccinated. Fortunately, the main target of over 60s, we're already over 60% of that portion of the population is vaccinated. And in fact, in some parts of the country, it's already over 70% of that is vaccinated. So there are sub-targets within the big target, but it is important that we now give children an opportunity and we start to vaccinate them.
Yeah, and what is your response to critics who are saying that this is, has always been the reaction from the health department? You just move on to opening another cohort of the population, as opposed to addressing the real issues around why some of the older people in the country are still not coming forward to get their jab.
Well, as I say, it's not either or. We have a very deliberate strategy to target older people. We know that over the age of 50, you are still at the greatest risk by far, never mind any other comorbidities anywhere. Age alone is a serious challenge for serious illness and hospitalization and death over the age of 50, and in particular once you get over 60. So those are still our primary target people, and we have strategies to deal with them. But there are children at risk. There are children who have medical conditions that will benefit from vaccination. There are children who are pregnant, unfortunately, and we would like them and the breastfeeding children to get vaccinated as well. And there are children who want to travel immediately after they finish their exams. There are children whose parents live abroad and they want to go and join their parents and they need to be vaccinated. So we must recognize that there's a very broad spectrum of requirements or demands from within the community, and now we are able to open up. We do have enough vaccine to deal with both sectors of the population, and we are very pleased to be able to offer vaccination to children now.
Right. Speaking of parents, the issue of consent has been a sticking issue for quite some time, at least since this announcement was made. On the one hand, the health minister saying that the children themselves don't need consent, but then government, I think yesterday, also releasing communication saying that they recommend that they arrive with their parents. Granted, those things aren't mutually exclusive. However, are you able to clarify for us what legislation backs the remarks made by the minister to begin with?
Yes, sure. So, obviously as responsible citizens, we want to encourage families, and we would like parents to take responsibility and look after their children, and that is not anything that anybody is suggesting should not happen. However, we live in a diverse society, and we have a lot of child-headed households where children between the ages of 12 and 17 are having to take decisions for themselves and their siblings every day. And we have the Children's Act, it's called, and that act has been in place since 2005. And there's a clause there, section 129, that allows children to take responsibility and consent for their own health care. And it's in terms of that thousands and thousands of children have come forward for vaccinations, for family planning, for various surgical procedures, chronic medicines, and so forth, without the consent of their parents for years. So that is not new legislation. It's not something that we are trying to invent. We're just saying that that is there, and it should not be a limiting factor if there aren't parents or guardian available to allow a child to be vaccinated.
Yeah. I've also seen an interesting discussion among public health experts who are, also trying to decode how effective just one dose of the Pfizer jab will be in this instance. Do you have data showing us how much a single dose of a Pfizer jab actually prevents things like the spread of COVID-19 even among children? I do appreciate the fact that children can't get 2 doses because of certain concerns, especially around health information for people within that cohort.
Yeah, I understand. So there are countries in the world that are vaccinating 2 doses to children, and there are others that are still on 1 dose of the same Pfizer vaccine. There's not a lot of data available at the moment, and it's growing all the time. So we've taken the more cautious approach that, for instance, the UK has taken, where we start off with a single dose, and as there's more information available, we may well introduce a second dose. And we should know within the next 4 to 6 weeks whether the advisory committee is going to suggest that we move to a second dose. It's been over one issue, and that's to do with what's called myocarditis, or inflammation of the heart, which has been reported in very rare cases. And I want to emphasize that, extremely rare cases, where a small number of children have reported that their heart beats faster, they feel uncomfortable in the chest, they may have a bit of pain in their chest, and that condition passes on its own untreated within a few days, but it is something that is being watched around the world. So we've decided to just wait because it appears to be more common after the second dose, and we would like to see what happens around the world around the spacing of the doses and whether this is in fact something to be concerned about.
Yeah, does that also mean that we don't really know how effective a single dose is among children at least?
No, we do know how effective a single dose is, and it does protect, not to the extent that a second dose does, because you remember that vaccines are stimulating our own immunity. They're not a treatment in themselves. So most people will make fairly good immunity from 1 dose, but when you are boosted by that second dose, and it's a second primary dose, if you like, and your body gets a kick again and gets reminded to make more immunity, you do get a better immune response, and I think that is well documented and well reported on. So it would be better and more advisable to go the 2-dose regime, but we're just waiting for more information about what the appropriate spacing would be and how concerned we should be about that spacing.
Dr. Nicholas Crisp, great chatting to you, sir. Thanks very much indeed for making time for us here on the AM Report. Dr. Crisp is the Acting Director General of the National Health Department.